Hi guys, Neil here again from the New Zealand Cheese School. Today I'm going to have a chat about mastitis and somatic cells and how this can affect cheese making. I'll attempt to share the screen here. Okay, right, so mastitis, what is it? Well, mastitis is the inflammation of the udder or mammary tissue which comes about as a result of a bacterial infection. This can come about through bacteria entering the mammary tissue, or a teat through a crack in the teats, or through the orifice through the sphincter muscle at the end of the teat. The infection instantly causes a reaction in the cow itself, and that's a signal that attracts white blood cells to the area of the infection. And the objective of those white blood cells is to, in fact, fight the infection and try to minimize the harm to the cow. So it's nature's way of actually trying to combat the infection. So just think about the fact that these somatic cells, in some sense, are antibacterial. So the white blood cells that are attracted to the infected udder can pass into the milk and do, increasing what we call the somatic cell count. Some of the cow's own body cells, the flesh tissue, may be passing into the milk as well as a result of the infection, the inflammation. So the combined count of the white blood cells and the cow's body cells are known as the somatic cell count. It's also got a couple of other names. One is from an individual cow, it's known as the individual cow cell count. And from a bulked herd milk, from all of the animals, if you test all of the milk in one test, that's the bulk milk cell count, but simply in the industry referred to as the somatic cell count. So normal figures of healthy cows are around 200 to 300,000 somatic cells per mil. That's a combination of white blood cells and the cow's body cells. And that is quite normal. You may have an exceptionally low level of 10,000 or 20 or even less than 100,000 is quite good. But this is a standard sort of level. If the cow gets subclinical mastitis, then the levels may increase up to between 400,000 and 1 million cells per mil. If the cow then develops further and the infection gets worse, to be fully blown mastitis, the level of somatic cells would be 1 million or more, and chronic mastitis could be several million. And this has some devastating impacts for cheese making. So why is it a problem? Well, the somatic cells contain enzymes. The enzymes are proteolytic in nature, and that means that they break down the protein, specifically the casein. And this happens in the udder prior to milking. So what happens is the casein is responsible for cheese yield, and if you're breaking down the casein, then you're reducing the amount of casein to be able to be made into cheese. An example here, it may be not quite exactly this level, but if you've got somatic cell count of a healthy cow and the protein level from that cow is 3.6%, that's probably broken up to 2.8% casein roughly and about 0.8% whey protein. These are the proteins that don't stay in the cheese, the ones that move into the whey. When the somatic cell count increases to 1 million, we could expect a slight loss of protein level, but not much. But we have a significant loss of whey protein, casein to whey protein. So less cheese making protein and far more protein lost from the cheese into the whey. So far less cheese. What we could expect perhaps is for the somatic cell count around 500,000, we might experience a 0.5% loss in cheese yield, but a somatic cell count around 1 million could be as much as 9% loss of cheese. So for every 10 kilos you might have been getting, you'll get 9.1, or for every 100 kilos, 91 kilos. So significant loss of cheese yield. The other thing is that the rennet doesn't work so well in milk which is mastitic, because that's a higher pH, and rennet likes to work in more acidic conditions. So the setting of the milk takes longer, and it's a weaker set as well. The starters themselves may work slower, although if the protein breakdown fragments from the whey proteins increasing, there's the possibility they could actually stimulate the starter cultures as well. So I think the judgment is out as to whether the starters overall work slower or faster. Syneresis, or loss of moisture from the cheese, or reducing the moisture from the cheese to get the correct firmness and desired moisture content, is minimized or reduced by these somatic cells. So not a good outcome for the cheesemaker. And of course, the flavor is not nearly so good. So that's the impact of mastitis and somatic cells on cheese. And hence, we want always to have as low a somatic cell count in the milk going to cheese making to give us the best quality cheese, the most cheese, and happy cheesemakers. Cheers.